lives here at the Pan American Health Organization. My name is Ashley Baldwin. I work in our Department of Communications. And this week, we're going to be talking about infection control in the context of COVID-19. The reason we're doing that this week is because on Tuesday, the 5th of May, it was World Hand Washing Day. So we really want to shine light on this issue. And I'm joined here today by two special guests. So we have Dr. Jonas González Garcia, who's advisor in quality and health systems and services at the Pan American Health Organization. And we're also really fortunate to be joined with a particularly special guest from outside of the Pan American Health Organization, Nurse Kisa Riley Harrow, who is a registered nurse at the Spanish Town Hospital in Jamaica. So welcome both of you.
Thank you.
Hello, thank you.
Thank you, Jonas. So I think one of the things that that we're noticing a lot in the media at the moment is the issue of infection control, and not just in the context of how do we protect healthcare workers, nurses, doctors, technicians, people who are on the front line, but also how we protect ourselves and our families and loved ones as part of the community. So I wondered, Jonas, to start, if you could tell us a little bit about how we prevent infections in the context of COVID-19, starting first of all on health centers. What do we need to be putting in place so that our frontline workers like Keisha are protected?
Well, indeed, infection prevention or control, it might seem or sound a bit complex, but today I really want to make give a central message, core message. If there is something that we have no doubt at all about, so many recommendations and discussions about how we can face that situation, and that it's valid for all times, is hand hygiene. We have to understand that microorganisms, when we get infections, most of the times, the transmission is through contact. So if we have clean hands, we are really working really in the good way in order to prevent and control infection. So it's said that we are facing an invisible enemy. Let's think about, for example, flour or dust. If we have flour or dust, just imagine, just to get that idea of having flour or dust in our hands, or a patient in a bed with flour, we will see the flour are all around the places that the patient touches. Well, we don't see the microorganism, but the behavior is more or less similar, and we can face that just washing our hands with water and soap, or eventually with alcohol hand rubs. And that will neutralize our visible enemy. And if we do that, we are doing the central thing. As I said, there have been many recommendations, many discussions about different interventions which are relevant. But if there is an intervention which no one has any doubt, is the central role in prevention and control of infection of hand hygiene.
Brilliant. So when we look at what's transmitting COVID-19, there's a lot of talk about droplet transmission. So how does that get transmitted? So I cough on my hand, and then with these invisible microbes, I'm touching someone else and they touch their face, and my hands are clean, by the way. They touch their face, and that's how it's getting transmitted. Is that correct?
That's correct. Keep in mind the idea of flour in your hands. Whatever you touch, the flour will not be flying in the air. It will get into the bed. It will get into the things you touch, and the things you touch more possibility, more risk that you have there, the virus or any other microorganism. This is nothing new. We know that now 200 years ago, we have been working, all healthcare workers know about that. But now we have like a big challenge in the context of the pandemic, and the big opportunity, not only in healthcare centers, not only in hospitals, not only in the facilities of the first level of care, but also at the community level, to really acknowledge that we have the power to neutralize in some way that risk, that invisible enemy, if we really improve our hand hygiene.
Okay, and hand hygiene is the vital step to ensuring that we don't transmit infection.
Not the only one, but the vital.
Okay. I'd just like to say hello to Dr. Silvia Cassiani as well, who's our advisor at PAHO in nursing and health technicians. Welcome, who's just joined us.
Thank you so much for inviting me for this.
Thank you. So before I start grilling Keisha on her experiences as a frontline worker in the context of COVID-19, Sylvia, I wondered if you could tell me a little bit about, Jonas mentioned hand hygiene, but when it comes to protecting our frontline nurses, what other infection control methods do they need to really be taking into consideration?
Okay, let me start talking about this year, that it's such an important year for nurses and midwives. So in honor of the Florence Nightingale, the founder of modern nursing, the WHO has designated the 2020 as the year of the nurse and midwifery, and midwives. So it will be a year to celebrate nursing and midwives, but we have so many initiatives, experiences to develop and to share, and now we have this important pandemic, that is making all the health workers working too much, sharing information and producing research and so on. Right now, the nurses and midwives, they have been applauding every day for the world, who are celebrating them as heroes, But at the same time, and now with your question, we have seen a lot of requests about the personal protective equipment,
Yeah.
The nurses need them to work with the COVID-19 patients. We have seen the efforts that the countries are doing to buy these equipment to assure the best equipment for the health professionals. But even though we have seen many of them with the disease contaminated and so many issues around the health workforce. But as Jonas just said, the vital is to wash hands. It's the clean care that we say. Clean care is in your hands. So nurses are used to work with the patients with transmissible disease. This is not an easy one. It's a difficult one, but we know how to deal with the patients with transmissible infectious disease. But we need to have equipments. We have to have better working conditions so we can perform our duty with everything that we know, and with the equipment. So it's important to have the personal protective equipment, by sure.
Brilliant. So if anyone else has any questions for our experts from PAHO or from Nurse Keisha, please don't hesitate in putting them in the comments that I think are just below the Facebook post, or just to the right of the Facebook post, if I remember correctly. And the experts will be more than happy to answer any questions that you have. Nurse Keisha, thank you again very much for joining us. And thank you for what you're doing as well. I wonder if you could tell us a little bit about some of the challenges that you're noticing on the front line when it comes to infection control. Are nurses and other healthcare workers able to protect themselves as much as they need to be doing so that they don't get infected with COVID-19 and pass that infection on to their families and loved ones?
Thank you very much for inviting me on this medium and for giving me this opportunity to speak on such a challenging topic. For our nurses, at this time, the Ministry of Health and Wellness and our various administrative bodies have been making valiant attempts to acquire the necessary protective equipment that we need. And we have our various in-service education officers within each and every institution, as well as our public health nurses, who are integral in the training of nurses, even before COVID, with, as Sylvia said, many infectious diseases have come before. So we have been trained and we are aware of what the protocols are and what we need to be doing in order to protect ourselves and our families. And as we get our protective equipment, we are trained how to put them on, referred to as donning, and doffing to remove them, and the necessary hand hygiene at every step in between the putting on and the removing of these equipment, and the necessary hand hygiene before and after contact with every patient. And even before we have contact with our own family, we practice the essentials of hygiene, hand hygiene, so as not to transfer these microorganisms to our loved ones.
So when you go into work every day, what's your, now particularly with the additional risk of COVID-19, and I'm more than aware that frontline health workers are always more exposed to certain infections, but now particularly, what do you do every time you come into the hospital? What's that routine of donning that you were mentioning?
All right, so upon entry, all of our entry points have been equipped with sanitizers, motionless in most cases, where we can sanitize our hands. We are required to wear face masks at all times once we are leaving our homes. Once you go into the general public, you are required to wear face masks, so much more when you enter the clinical area. We also are required to wear our face shields as well as our gowns to protect our outer clothing. And if necessary, once you're coming in contact with a suspected patient or
Okay. Well, while we get back, Keisha with us.
So while we're waiting for Keisha, I want.
Oh. Yes, she's back. She's back.
Excellent. We lost you for a second there, Keisha. It's fine.
We don't want to lose you.
We don't.
No, nurse. Please.
Not now, Keisha. Not now.
Never.
So I'm not sure where I was lost, but I was making reference to the point that it is a requirement that once we are in the general public, and so much more once we enter the clinical area, to be wearing our face masks. At our entry points to our clinical areas, there are hand sanitizers that are positioned strategically, both for the staff and the clients who are coming in for use of the service and our other support staff. We are then required to put on our face shields and our masks and other protective equipment if we are going to be coming in contact with individuals who are suspected of having the coronavirus or any other SARS-related viruses. And we have a paired body system where individuals who are donning these protective equipment have someone there to assist them in following the guidelines of the checklist to ensure that they are properly protected before they have contact with individuals.
Brilliant. Thank you so much for going over that for us, Keisha. Jonas, you mentioned about the hand hygiene and how hand hygiene is one of the most important infection control methods that we can employ. So when it comes to the general public, what exactly do I need to be doing? Do I need to be washing my hands, every half hour? Do I only need to be washing my hands when I go out and I come back? What if I get the post from the mailman? Do I then need to be washing my hands? How long do I need to be washing my hands for? What kind of soap do I need to be using? What's the standard protocol to make sure that I'm as protected as possible and don't transmit some of those microbes to my family if I leave the house, for example?
I would say it seems complex, but it's simple. If we keep in mind that idea of having dust in our hands, and of course the dust goes to every place we touch, we need to maintain safe and clean our hands. So just think you can see that invisible enemy. You must keep cleanse your hands with water and regular soap. That's more than enough. We have the effect of water that is important, mostly when you have visible dirty in your hands. But let's be clear, also alcohol hand rubs, solutions with at least 60% of alcohol, will be as efficient as water and soap. We only need water and soap if we have visible dirty in our hands, or we have some liquid or something into our hands. But if not, and we don't have access to water and soap, using alcohol hand rub will be good enough.
Okay.
And I would like to also emphasize what all the measures, and that's a fantastic example we have from Jamaica, from our colleague Kisia, and she shared how she has been trained in using all those protective measures, which are really relevant. But if they don't maintain, and this is clear, they maintain hand hygiene, it will be lost. Even frequently, we may have a misunderstanding about the use of gloves. Using gloves doesn't mean you don't do hand hygiene. Let's keep that idea of dust in our hands, or dust in the bed of a patient, around the things that a patient touches. If you get to there with gloves, you touch this patient, you will get the dust in your gloves. And if you go to another patient, you maintain your gloves, you are taking the dust from one patient to the other. So you have to get out of your gloves, make hand hygiene, and put new gloves. Use the gloves when you need them, but they are not a substitute for hand hygiene. And that's something that is a mistake quite frequent. For the life at home, and just keep in mind, you have to keep your hands clean. If you have not touched anything and you are at home, you will not need to clean so much, to wash your hands so much, as if you go outside and you are in a public transport, or you are touching surfaces that are frequently touched by other people, because obviously there might be more risks there. If you get into a hospital, the risk, if there are people who is sick, of having the invisible enemy all around places, mostly when closer to the patient, is higher. So you have to behave just to as frequent as you are in risk of having your hands not clean.
Okay. And as far as, because there's reports that the COVID virus can live on certain surfaces, on certain plastics and metals, for example, for hours. So when it comes, what measures should I be taking as an individual, as a member of the public, as far as disinfecting door handles are concerned, or car handles, the car door handles and things like that? Is it also really important that those surfaces are frequently cleaned by members of the public?
Well, I would like to keep in mind one call from our Director General, WHO Director General, Dr. Tedros, on the 1st of April this year. This is very relevant. He has asked all the state members, and I think every one of us can make a role for that, advocacy for that, to introduce, to facilitate hand hygiene stations in every place for public transportation, and when you are entering any public or private building, making easy to make hand hygiene properly. What I want to emphasize is that, of course, if you clean more frequently surfaces which are more touched, that's good. Right. But finally, the invisible enemy doesn't fly. It only comes to you, and to your nose, to your eyes, or to your mouth when you touch, and you directly get it from what the surface you touch to your mouth, to your nose, to your eyes. And the easy way, the most efficient way to avoid that, hand hygiene.
Hand washing.
Hand washing, alcohol hand wraps.
Right. Okay. Just a quick reminder, if anyone in the audience has any questions about infection control and about hand hygiene, please don't hesitate to put them in the comments section. If you have questions about anything else, we're going to be having other sessions every Friday. So we'd be happy to answer questions about vaccinations and treatments and things like that. But this session is specifically for hand hygiene and infection control. So any questions related to that, we're more than happy to answer. A couple of things that have been mentioned in the course of this conversation are PPEs. Sylvia, what are PPEs? What are we referring to when we talk about PPEs?
PPEs are equipments, that the health professionals, they use to avoid to have contact with some germs or microorganisms that could infect them. At the same time, as Jonas has commented, to avoid that when they care for one patient and they go to another patient to transmit this disease. So it's for themselves, to protect themselves, and also to protect others, because also they can transmit for a patient that is in the hospital taking care, they can transmit their disease to the patient. Okay. So it's an equipment, that they have to be used. And as nurses, as I heard my colleague saying, we know how to use this, but at the same time, we need them. Mm-hmm. It's something that the services and the government and the health services, they need to provide. We have heard some histories that the nurses and other health professionals, they are asking for equipment. They are asking for gloves, they are asking for masks, they are asking for equipment that they need to use, or because they do not have, or they do not have enough.
And we're hearing reports of this from everywhere in the world. It's not just our region. Yeah.
Yes, that's true. But we have to say that the world is preparing themselves. At the time that we are surprised by such a big pandemic, maybe the world was not prepared for this. But I feel that day by day, the countries are more aware of this. They are looking for, they are trying to connect each other and to have the equipment. And we have to say that it's not just for health services. We have heard another necessary equipment for other workers, not just the health workers, that they need, in the cemeteries, or even in the laundry, or even to the cleaners, they need these equipments. So it is something to protect themselves.
Okay. So when we're talking about PPEs, we're talking about things like masks and the gloves and the visors in some cases, and the gowns that nurses and doctors and frontline workers and some other key workers are having to wear as well, and need to wear really in order to protect themselves and to not get infected, and then not to become a source of infection for other people. And we have heard reports from all over the world, not just Latin America and the Caribbean, of frontline workers not having access to the PPEs that they need for a variety of reasons, and a lot of that has to do with preparedness. But when we look at the Caribbean context, Nurse Keisha, how are you? Do you have an ample supply? Are there any challenges that you and your colleagues are facing at the moment with PPEs and being able to keep yourselves safe?
Yes, we are experiencing the effects of the global shortage of PPEs. And as a small Caribbean nation, we too have that challenge. Our administrative body and the Ministry of Health and Wellness are making valiant efforts to procure the supplies that we need. And as such, we are creating guidelines and policies in reference to how we inventorize what we do have and how it is utilized by the necessary staff that have to use them. To minimize wastage and to ensure that we get the best use of what we do have at this time.
Mhm.
Brilliant. And are you working on a ward directly with patients that have COVID-19?
I am one of the most frontliners of all. I am the charge nurse for the emergency room at the Spanish Hospital. So the first point, one of the first points of entry is the accident and emergency department. So our team has created a protocol of how we handle incoming patients. Persons are screened.
I think Keisha we might have lost her again there.
Yeah, well, this is a fantastic testimony I want to emphasize. And together with all that equipment that is required for protection, I would say the number of nurses, we have her back again. So we need more cases, I was saying. We need the number of professionals and nurses we have in a facility, in a ward, in an emergency room, in ICUs is absolutely relevant in order to keep it safe. And to give them the opportunity to do the work right. So investing and supporting these professionals is really also something that we need to emphasize.
Right. So it's not just about making sure that nurses and frontline workers are equipped with the PPEs that they need and are equipped with any training perhaps related to a specific virus, but it's also important that we have the staff themselves and a certain quantity of staff in order to keep everyone safe on the front lines.
That we care for those professionals. So
yeah.
they take enough rest, that they have, well, you know. Please, Keisha, I think this is an honor having you here. So
yes.
I'd like to hear from you. Yes, your experience in the front line.
I somewhat got disconnected just now, so I'm trying to catch up to the conversation. So Ashley, what am I responding to at this time?
We were just wondering how you were finding, particularly as a nurse who's couldn't be more on the front lines of the COVID-19 pandemic in Jamaica specifically, how you're finding everything. Janas was mentioning that it's very important that nurses are equipped with the PPEs that they need in order to stay protected, but it's also really important that we have enough nurses working on the front lines. And we just wondered how you're experiencing that particular issue as far as staff resources are concerned and sufficiency of personnel.
Right. As you know, yes, it is the year of the nurse and the midwife, but we are also facing a global shortage of nurses right across the nation. And as such, we have had to have creative mechanisms to ensure that we have adequate staffing to cover and provide quality and safe patient care. So we are trying to, at this time, make best use of the volume of individuals who we have. We are reaching out to individuals on part-time as well as full-time basis to ensure that our gaps are filled and that we can provide the care that our clientele needs.
Jamaica, as well as other countries, they are facing the migration of nurses, no, and other healthcare professionals, no, and also the professionals who are infected, they are out of the service, So even though we have the shortage that it's usual, we face with more problems when the staff cannot work because they are out of the work because of the disease, if they are infected or contaminated, no? As a matter of fact, the world needs 9 million more nurses for 2030, no? And I'm sure that by the end of the year, we are going to have more data in face of the COVID-19 because we are losing nurses in the service. We are losing, the nurses are dying because some of them are getting infected, by the COVID. So we are getting more evidence by the end of the year with the impact of the COVID-19 in this percentage of the shortage of nurses in the world.
So to compound that shortage of 9 million nurses, we're also facing even worse conditions at the moment because we have so many nurses and frontline workers that are, out of action or are having to isolate themselves at the moment because they've come into contact with COVID-19. So it's putting a tremendous amount of pressure on our frontline workers who we need more than anything at the moment than they have to deal with, on a regular daily basis anyway.
Yeah, that's why the hand hygiene day comes in an opportunity to discuss the importance of the hand hygiene to protect health workers. So that's why we are saying, stay at home, because if you stay at home, you are protecting the health workers, and at the same time to make clear for the public the importance of them to use these mechanisms to protect themselves.
Right.
So everybody's protected. So the hand hygiene day is emphasizing the hygiene of hands, because as we said, this will be the first contact between the people, between the persons.
So by the simple act of washing my hands, which Jonas has reiterated throughout our talk, I'm not just protecting myself, I'm not just protecting my family and anyone that I might be isolating with, but I'm also protecting people like Keisha, because I'm not contributing to the spread of COVID-19. And that's why I know in a lot of countries, in my country as well, we're having a sort of clap for all of the nurses every week and things like that. And I think finally frontline healthcare workers are beginning to get the recognition that they deserve for so long for the work that they're doing. But a simple act of recognition of the importance of the work of frontline healthcare workers is washing our hands.
Yeah.
So
you can save lives.
Yeah. Well, I just have one final question for all three of you. Perhaps we can go individually. And I just wanted to ask you, what is and I know what Jonas is going to say, so what is the main message that you have for people in the community, not just frontline healthcare workers, as far as prevention control and keeping COVID-19 curves as flattened as possible is concerned? What are you going to recommend, Jonas?
Well, for me, it's clear. We all have a role in improving hand hygiene, and this is central now. It's always been very important, but now it's central. So if you are at the community, if you're a mother, if you're a father, if you're a child, just be a role model for others. If you see things done well, celebrate that. If you think situations in which things are not done so well, in a polite way, try to engage people so they correct their practices. And today I also want to really emphasize the central role of nurses. They are the closer health workers to the patient. They know what's going on every minute, morning, evenings, nights. They balance safety, but also emotional situations. And this is really challenging. I think we need to celebrate them. We need to protect them. We need to invest in nurses, as all health workers are dependent, and patients are dependent on having good nurses. So I want to invite all people to celebrate and to care for our nurses. That will be my message.
Thank you, Jonas. And Sylvia?
In the World Health Day in last April, PAHO asked the countries with 4 words, and my message is these 4 words, trusting nurses, value nurses, recognize their work, and also to the government, to the society, invest in nursing and midwifery. And I want to enjoy this opportunity to invite everybody to the next Tuesday, May 12, is the International Day of Nurses, to celebrate the work that the nurses are doing. Thank you.
Thank you. And last but certainly not least, Keisha, the Jamaica's Nurse of the Year. So we're very privileged. What would be your final message for everyone?
My final message for everyone would be we come to work for you. We are only asking that you stay home for us. Practice social distancing and hand hygiene at every given opportunity. Learn as much as you can about this virus and what it is that you need to do to protect yourselves and your family, and adhere to those principles. And I just want to say to all the nurses globally, this is Nurses Week, May 6th to May 12th. And on International Nurses Day, I wish you all a happy and safe International Nurses Day.
Thank you so much, Keisha. We all do. So a big thank you to our participants, to Jonas, to Sylvia, and to Keisha, and a huge, huge ongoing thank you, as Keisha said, to all of the nurses. And I'm sure some are watching at the moment, but we're hugely grateful for everything you're doing. Thank you very much. Bye-bye.
Thank you. Bye.
The nurses.
Thank you.